because I want to be able to show you guys videos, okay? And we can't do that in Google Meet, which is such a bummer. So what I'm going to do is I'm going to throw in the meeting ID number for Zoom. Okay. Let me come back over here. Okay, where's my chat box? Perfect. Okay, so there's the information for Zoom. So you guys should be able to just to join right in, and there's the password if they ask for it. So just leave Google Meet open for just a second until you can get into the Zoom. And then once you're in, close Google Meet. I think so. You can just, yeah, that would be a 0. Okay, Peyton's in. All right. Perfect. So now we're back, but we're in Zoom. And hopefully Nicole will make her way over soon. So what I'm going to do is I'm going to share my screen. There she is. Perfect. Okay, can everybody hear me?
Yes.
Okay, perfect. All right, so now let's talk about ADHD. Okay, let me share. Computer sound, perfect. Okay. So here's what we're gonna look at. We're gonna look at ADHD. We kind of talked about it on Monday when we were looking at the developmental disorders. And those are the ones that, you know, they start in infancy and they kind of watch them through childhood. So like autism, ADHD, etc. What do we already know about ADHD? Do we know somebody who actually has been diagnosed with ADHD?
I do.
Oh, you don't have to tell me who it is, obviously. We keep
No, that's fine.
Here. But what are some of the things that they struggle with?
Well, like when they don't take their medication, like they get really depressed.
Mm-hmm.
And like aren't able to focus or do any work or anything when they're not on their meds, and they have to wait for them to kick in.
Yeah. And how long usually does it take for the medication to start working?
I don't know, but I know that they last for around like 7 hours.
Yeah. So we're going to learn. Anybody else know anything about ADHD that you want to jump in on? The term gets thrown around a lot, right? If ever somebody is not being able to pay attention, immediately everyone's like, oh, he's ADHD, right? Or she's ADHD. Look at her, she can't sit still, right? But it's an actual diagnosis. So it's not someone that just can't pay attention, and it's not someone that just can't stop moving. That happens to all of us sometimes, but it's an actual diagnosis. So we're gonna watch just a quick video that's really gonna describe, and what's really cool is that we all studied the biological basis of psychology, right? So we talked about neurotransmitters. Was everyone able to see the notes sheet that I put into Classroom for this?
Yeah, I have it open.
Perfect. It's a really simple one. Basically, all we're looking for, and you can just take notes on your own, or you can go back and watch this on your own if you want to. We're really just kind of looking for, like, what is it? What causes it? Is it nature, meaning is it a biological thing, or is it nurture, meaning it's the environment around us that's causing ADHD? So I want us to watch this, see what we already know. You're going to hear a lot of stuff that you already know. Now it's going to all kind of come together, and then we're going to talk about it at the end. All right, here we go.
What most people know, or think they know, about attention deficit disorder, or ADD, is that it's used to describe someone who can't stay focused, and when they really can't focus, they have attention deficit hyperactivity disorder, or ADHD. This continuum from one to the next isn't quite how it works, though. ADD and ADHD are actually synonymous, as in they're the same. ADD is an outdated term used prior to 1987, after which it evolved into ADHD to encompass more of the symptoms that people with ADHD often experience, which, in addition to being inattentive, includes both hyperactivity and impulsiveness. So somebody might be diagnosed with ADHD because they have symptoms related to not being able to pay attention, but they might also be diagnosed with ADHD if they have symptoms related to being overly active and impulsive. They might also have ADHD if they have symptoms of both. According to the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, the most recent update being in 2013, ADHD is split into 3 subtypes: inattentive, hyperactive impulsive, or both. Inattentive and hyperactive impulsive have a set of 9 symptoms each. For example, someone with the inattentive subtype might make careless mistakes, or not listen, or be easily distracted. And someone with a hyperactivity and impulsive subtype might fidget, or squirm around, or get up from their chair often. Now, you might be thinking that everyone fidgets now and then, right? Well, a diagnosis is given when someone has 6 of the 9 symptoms for either subtype for at least 6 months. Most commonly, though, children have symptoms of both subtypes, and therefore have the combined subtype.
So let's talk for just a second. In order to be diagnosed with ADHD, do you have to both have the inattentiveness and hyperactiveness?
No.
No. So even though the title is ADHD, it doesn't mean you have to have the first part, the attention deficit part, and it doesn't mean you have to have the hyperactivity part, but that can be present. And so sometimes, or a lot of times, especially in younger kids, when they get diagnosed with ADHD, they often at a younger age will show both, but part of that is just natural growth as well, right? And it's hard to distinguish the line between the two. When it's diagnosed in teenagers or young adults or even older adults, a lot of times you'll see where it's probably one more than the other, but still you can have both. But a lot of times the both plays a part usually in the younger years. Okay, here we go.
What's the difference between boys and girls when they have ADHD?
Ooh, that's fascinating. I've got a whole article on that, so I'll put that in there. But they really show signs and symptoms a lot differently. A lot of girls, especially young girls, don't necessarily have the hyperactivity portion of it. Instead, they find that the attention deficit will present itself more as not engaging. They kind of remove themselves from situations. What would seem like they are lethargic is really not them being lethargic. It's more of just this imbalance. But we're going to he's going to talk about the chemicals in a minute, and that'll help kind of explain some of those things.
Since ADHD is considered a neurodevelopmental disorder, the symptoms also have to have started between age 6 and 12, and the behavior can't be appropriate for their age. Alright, but what causes someone to be hyperactive or impulsive or inattentive? Well, as you might guess, it's pretty complicated, and we don't really know. Probably a lot of different factors, and ultimately they all fall into some combination of environmental and genetic factors. One interesting clue to a genetic component of ADHD is looking at families. For example, a child with a sibling that's been diagnosed with ADHD is more likely to develop it themselves. Furthermore, if those siblings are identical twins, meaning they have the same DNA, their chances of developing ADHD is considerably higher.
Okay, so let's talk about that here. Do they really know what causes ADHD?
No.
No, they don't. They still don't. The brain is so complex, but they have some ideas because they're going to get into it in just a second. They have some ideas that there may be some environmental factors, but there are definite genetic factors, which would be biology or nature, right? How do they know that there's probably some nature factors to it? How would I
Like
know? Yeah, go for it.
maybe one child's just like naturally born and they're more impulsive. Maybe they don't have any other siblings, and they're
Okay. But
yeah.
that would just be one individual. So how would I know that that isn't the environment that I'm raising that kid in? How do scientists and psychologists really pull out data and say, yeah, there's probably definitely a nature factor here because we're seeing it in what?
Like because it's being seen
6
in so
years.
many people.
Yeah, and especially people that are related. When you're looking at genetic factors, if you're seeing a pattern of it within a family, then we're talking genetics, right? So same thing we talked about with those twin studies, that those are so important because it does give, even though they weren't done ethically, but it did give psychologists a lot of good data as far as things that are genetic versus things that are from the environment. All right, here we go.
Having identical DNA doesn't mean that the twin is definitely going to develop ADHD, though, which again suggests that both genetic factors and environmental factors play a part. As to a specific gene, it's probably not one single gene that leads to ADHD, but rather multiple genes that determines how severe their symptoms are. These genes likely influence the production or regulation of the brain's neurotransmitters, which are signaling molecules in the brain that are released by one neuron and received by receptors of another neuron. This movement of a neurotransmitter from neuron A to neuron B is basically a message being relayed. It's like the neurons are talking. Dopamine is a specific neurotransmitter that gets released when the brain's involved with behaviors like getting a reward, taking a risk, and being impulsive. Norepinephrine is another neurotransmitter involved in attention and arousal. It's thought that lower amounts of these two neurotransmitters floating around contributes to symptoms of ADHD. The reason why these neurotransmitters might be down in the first place is still not well understood, and research remains ongoing. Now, treatment for ADHD can be tricky, since symptoms might vary from patient to patient, although it most often involves either behavioral psychotherapy, medication, or both. Behavioral psychotherapy is often targeted at children and focuses on teaching the child better time management and organizational skills. For example, having structured routines that they can follow, and then giving rewards when they stick to those routines. Also, involving both parents and teachers are important, and both behavioral parent training and behavioral classroom management have been shown to be helpful for children with ADHD. For adults, behavioral psychotherapy might focus on ways of decreasing distractions and also improving organizational skills. If medications are prescribed, typically the first-line options are stimulants. Since it's thought that low levels of neurotransmitters are involved in ADHD, stimulants are used because they tend to increase the number of neurotransmitters, like dopamine, between neurons, therefore reducing symptoms. Common and well-known ADHD medications are molecules that are chemically similar to illicit stimulants like methamphetamine, but there are some key differences to keep in mind here. All of these chemicals help to increase the release of dopamine from neuron A, but the ADHD medications typically cause a slow release of dopamine, whereas illicit stimulants like methamphetamine cause a really fast release of dopamine. In fact, it's this incredible surge of dopamine that disrupts normal communication between neurons and produces euphoria, and is the reason that illicit substances like methamphetamine are highly addictive. In contrast, the slow and controlled release of dopamine caused by ADHD medications is key and helps a lot of patients improve their focus and their attention. Thanks for watching.
Okay, so let's discuss what else do we know about ADHD and what he was just talking about with the neurotransmitters? how do we know that it's also a nature factor?
By testing their neurotransmitter levels.
Yeah. What else? You're on the right
Like,
track.
if it's because it is like a neurological disorder and it like does involve neurotransmitters, like that makes it inherently nature, right? Like because it is something that's like happening in the brain.
Yes. They know that if they're using medication to correct those neurotransmitter issues and it works, then you know that it's a biological thing that's happening inside the brain, right? So they're using, in which seems silly because we're going to watch another video in just a second where we're going to talk about the types of medications they're using in order to correct this, but it's showing that they're using stimulants. And so there's actually a large portion of the population that participates in illegal drugs on the stimulant side that are actually just self-medicating because for those people, those stimulants work and they just never have been to a doctor to get it diagnosed, but they use illegal drugs in order to help ease their mind, right? So it's very fascinating. So here we're going to watch just not the whole thing, but I'm going to go to the next one so that we can see just a little bit more about how stimulants actually work in the brain.
Odds are you have heard of Ritalin or Adderall. They're both members of the class of drugs called stimulants, and they're often prescribed to treat attention deficit hyperactivity disorder, better known as ADHD. But stimulants and hyperactivity seem like a weird match. Like if somebody can't sit still, why would you give them more energy? Like with a lot of other psychiatric treatments, the answer has to do with a chemical imbalance in the brain. The way stimulants affect that imbalance can reveal a lot about what's really happening when you get distracted or hyperactive, and what changes when you are focused and attentive. It can also explain why if people without ADHD take these meds, they might not be getting the boost they think they are. ADHD doesn't look exactly the same in everybody, but most of the symptoms fall under one main category, executive functions, which are essentially the mental processes that help you get things done. These include the qualities that usually come to mind when people think of ADHD, like focusing or remembering details, but the symptoms can include problems with other things too, like organization, time management, and controlling your impulses and emotions. We haven't completely nailed down what's happening in the brains of people with ADHD, because looking directly into people's brains turns out is pretty hard. But one of the main ideas is the low arousal theory, which basically says that people with ADHD have chronically under-aroused brains, and that stimulants help by increasing their arousal. To be clear, arousal in this context just means there's less brain activity in certain regions. When someone's brain is under-aroused, it could mean their neurons aren't firing as much in certain regions, or that some neurotransmitters, the chemicals that communicate signals between neurons, aren't flowing properly. According to the low arousal theory, this leads you to look for new stimulation in your environment to jumpstart your neural activity. And from the outside, that looks like you're hyperactive or just inattentive. More specifically, the disorder has to do with where you find dopamine, a neurotransmitter related to the brain's pleasure and reward responses. Generally, more dopamine translates to a greater feeling of reward. When your dopamine levels are high, you just feel good. One way to measure this is called the tonic dopamine level, which is how much dopamine is kind of hanging out between your neurons already. But there's also phasic dopamine, which is what your neurons release based on a stimulus. Anything from finishing your PhD thesis to noticing a pretty bird outside your window. Both kinds of dopamine levels are important because they affect each other. If you have a lot of tonic dopamine, for example, it can make the phasic response smaller. Neurons get a signal that there's already a lot of dopamine outside the cell, so they don't have to release as much when they try to send a signal to the next neuron.
Okay, so let's talk about this. Why does it seem, if you got someone that has ADHD, right, and we've got the hyperactivity aspect in there, doesn't it seem counterintuitive to give them a stimulant? If somebody already has so much energy, it seems silly that we'd be giving them something that would increase their energy. But what is actually happening in the brain?
They're looking for something that can get them aroused, or like, their brain is less aroused, so they're trying to look for something to get their brain aroused, but it looks like they're hyperactive.
There you go. So while their body is showing signs of being overly aroused, their brain is actually under aroused. So by introducing a stimulant, you are doing what?
Boosting arousal. in the brain.
And what are those neurotransmitters that they talked about that you really need to be filled? Yeah, there you go, right? So it always seems silly that you would, if someone was so hyper already, that you would give them a stimulant, but it's because they are lacking that arousal. And again, that just means like an awakened state in which you're able to function, right? We're not talking sexual arousal. That's completely different. So what's the difference then in how drugs that are made for ADHD work versus stimulants that are illegal drugs? What's the main difference why one is better than the other for people with ADHD?
One is tailored to the need of ADHD, while the other is general.
How is it tailored?
Isn't there like specific like measurements or like that doctors give to their patients?
Okay, what does that
Like
mean?
prescribed?
Like, are you talking about like the dosage?
Yeah.
Yeah. But what did they talk about in the video, in both videos, that was difference between illegal drugs that are stimulants and then also the ones that doctors prescribe specifically for ADHD? What's the main difference that makes the ones that the doctors use more effective?
Maybe it's medicated.
No, it's not the dosage. We talked about this, right? When we take other drugs, like let's say you take cocaine, and you've got this sudden rush of cocaine that's blocking, right? It's going to block different receptors, and it's going to cause you to go into that high feeling of movement. It's a stimulant, right? But it's coming in, and it's right away blocking, and then it's giving you the energy. But how long does that last?
Oh, so ADHD has a delayed response. So it like comes out over time?
That's exactly it. So what they've done is they've taken the effects of those illegal drugs, because those illegal drugs do work, but the problem is they work for a very short amount of time, plus they do other damage. So what researchers did is they saw what those drugs could do in somebody with ADHD, and they narrowed it down so that it only gave the good benefits, right, of those stimulants, but they also made it delayed release so that it was continuing to release that drug so that it could fill the role of those neurotransmitters for longer throughout the day. So it gives you an increased sense of functioning. Does that make sense to everybody?
Yeah. Then they just put like wax over it, and then so like it gradually was dissolved.
No, it doesn't work that way. So, but that's a good thought. Does anybody know of an everyday stimulant that actually a lot of ADHD people use?
Caffeine.
Caffeine, that's exactly right. So caffeine, a lot of people who have ADHD and they don't want to be on high levels of meds will often use caffeine to help regulate their system as well. And so they will just consistently at certain points in the day introduce caffeine into their system, because remember, for most of us, caffeine is going to come in and it's going to block adenosine for us, and it's going to give us that sense of alertness, right? Well, same thing's going to happen, except it's going to calm their body down because it's making their mental arousal go higher. Does that make sense to everybody?
But doesn't tolerance build over time, so they need more?
Absolutely. And that's going to happen with medications as well. So a lot of times people will have to switch either dosages or they'll have to switch medications just to do a different type of stimulant. Good, 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 good. Okay. So what I've done then is I've just put a couple of stories on here for you guys to watch. I think it's really important that part of what we do in this class is not only do we talk about, you know, the biological basis of it, but we're really in this to understand people better. Like, why do people do what they do? Why do they think what they think? Why do they feel what they feel? And part of the psychological disorders unit, I think it's so important that we remember that these are human beings that are suffering from things that are causing them distress or discomfort. It wouldn't be a disorder if it didn't significantly mess with their daily function, right? Or if it didn't significantly go against what society says. So in a case like ADHD, we have to remember that this is something that their body isn't allowing them to function at the same way that our bodies do. So what I've put in here is I put a story about Brad, who's a 12-year-old with ADHD. And I think it's a really cool story just to watch. So I won't play it. You guys can watch it on your own. But I think just to remember that they're human beings and kind of the way that ADHD gets looked at and how people are treated sometimes based on these. I also put a video in here of what it's like to live with adult ADHD. So does anybody remember from that first video, when do the symptoms have to be present in order to be considered diagnosed with ADHD?
6 to 12.
Yep, 6 to 12. So if someone is then diagnosed as ADHD in adulthood, is that really ADHD?
Yeah.
No. Oh. What do you think?
I mean, if their symptoms were present then, but they like never were able to go to a doctor, then isn't it still ADHD?
There you go. So if they are diagnosed in adulthood with ADHD, those symptoms were present when they were 6 to 12 years old. It's just they were never diagnosed as being that. And sometimes, you know, and especially with the stigma of mental health, a lot, you know, it's very, very common that people that are in adulthood now never went to a doctor to see them about mental health issues because it was seen as a bad thing to have mental health issues, right? Where mental health can be a range of things and ADHD falls under there. So so those, when they said that in that video, 6 to 12, that is a diagnostic tool, but what they'll do is they'll start asking adults questions, you know, they'll say like things like, when you were in school, tell me about how you handled XYZ. So they'll look for if those symptoms were present in the younger ages as well. So I think these are really two really cool videos. They're really short, but it just gives you an idea of what it would be like to live with ADHD and, you know, to really feel like you have trouble functioning or you have trouble fitting into society when they don't necessarily understand what you're going through. So I will put those in there. So here's what I'm going to do. I'm going to put this slideshow in. I'll put the other one in with those other slides that we talked about with where we finished up the DSM. And then it'll be a quick quizzes on the DSM-5. And I said this last time, but I'll just give you a situation like where I say, like, I've got a 22-year-old who every time they're in a scary situation, he pees himself. Which one of these categories would that fall under? It falls under elimination, right? I've got a 26-year-old female who eats large quantities of food and then she throws it up. Well, that goes under feeding and eating disorders. So you're just going to choose, all the answers are going to be there. You're just going to choose it for me, okay? And then on this one, on ADHD, it's just going to be the basics of, you know, what's actually happening in the brain, what, you know, what do we know about as far as the causes, even though they're not totally sure, but just the basics that we talked about inside this video. And then we were talking about just now with how stimulants work and why doctors will prescribe the slow release or the delayed release medication versus trying to get people off of taking illegal drugs or only using caffeine, but trying to get them on a regular schedule of medication. Does anybody?
While we're still on, sorry, while we're still on medication, sorry, my dog is barking. So for people with ADHD, does placebos affect them more? So like if they had like a drug that said it works for ADHD, would they feel those effects?
If you use a placebo?
Yeah.
So a placebo is just a fake pill, right? So if somebody truly has ADHD and they need medication in order to help those neurotransmitters work properly, then no, it wouldn't work. If somebody had been suggested to that they have ADHD, so in their mind they think they have ADHD, but they don't actually have the symptoms of it, and someone tells them, hey, this medication will help you, then yes, but that would be something where they don't actually have ADHD, because there is that piece, there is that nature piece or the biology piece where you have neurotransmitters that are not functioning correctly, and you have to have medication to help correct those. The other thing about ADHD is, besides medication, there are a lot of other ways that you can help treat ADHD. So a lot of people who have ADHD will choose not to be on medication, and instead they will train themselves to do the things that don't come naturally to them. So if they have trouble paying attention, if they have trouble organizing things, then what they'll do is they'll go through therapies, behavioral therapies, that allow them to learn how to do those, so that they are consciously making choices to organize, to pay attention, etc. Because a lot of people don't like to be on the medication. So, because there are side effects to the medication for ADHD as well, just like any other drug. So some people are saying, you know what, I'm happy with who I am, and I would prefer to go through behavioral therapy and kind of teach myself how to deal with these things. Does anybody have any other questions? Does that give you a better sense of what ADHD is?
Yeah, but I kind of want to watch the Brad video because I want to see like what really is it like to live with it.
Sure. You know what I'll do? I'll go ahead and play it, and people that want to watch it, stay on. If not, you can watch it on your own. I'll post the PowerPoint in just a second when I'm done playing this. Okay, here we go. Let me share that again. Okay, computer sound. Okay, here we go. Let me go back. All right, and I want you, as you're watching it, I want you to think about being a 12-year-old kid and dealing with this, and then kind of, you know, how does society see you? And maybe what do they not understand about you as somebody that is dealing with ADHD?
This is my Lego town, and it's basic, and tons of things are happening. There's the blue building. I'm good at Legos, and I have ADHD, and I kind of have trouble thinking of some ideas. I have thought organization problems sometimes.
12-year-old Brad Beecham loves Legos, playing outdoors, and showing off his treehouse.
Okay, so this is my treehouse. Inside, it's totally awesome.
He's also been diagnosed with ADHD, or Attention Deficit Hyperactivity Disorder. The National Institutes of Health estimates as many as 4 million children in the U.S. have ADHD.
I have a lot of trouble staying on track with homework, so I might get distracted. About one out of every 5 minutes, I'm probably distracted with homework, so it takes me a long time.
However, Brad's imagination has been vivid ever since he was very young.
You know, he was so out of the box and so verbal and so creative. He was always thinking about how things work and why things don't work, and just a really, really deep kid.
Like sometimes if I'm supposed to be writing an essay about glasses, I'd be thinking about talking wolves, eating cabbages, sitting at a dinner table.
His poems show that deep side too.
There's a party under my bed, and I was not invited. Between you and me, I was delighted. I got sad, then I went mad. I got so scared, my vocal cords blared. I kicked off the covers and looked under the bed. Here's what I said to those horrible monsters in my head. Be quiet!
Between the laughter and frustration, Brad and his family have learned to focus on the positive, letting the creative drive the agenda, like this Lego movie, directed, produced, and starring Brad Beecham. With treatment and special classes, Brad is making great progress.
You want to tell them what your grades are?
My grades in school are 4 A's and 2 B's.
So I love this story because it really highlights, I mean, don't you just feel for him?
I kind of like, yeah, because as a kid, I used to play a lot with Legos. So I was like, oh, that's like really cool that like he's using that as like an outlet to sort of express himself more.
And I think it's really neat because his parents really encourage him to be who he is and highlight the good things that come out of being ADHD, all of his creativity. But I want us to think about, you know, think about people you know whose parents are not as engaging with their kids, or think about teachers who punish kids because they can't pay attention, right? And so when you think about, I mean, how often did he tell you that he all of a sudden will lose focus?
Every 5 minutes.
Yeah. I mean, imagine trying to accomplish things and then every 5 minutes your brain is just off in a whole nother direction. And it's not that he doesn't want to complete things. It's not that he is trying to be difficult. It's just that's the way his brain is functioning. His mental arousal is so low that he's seeking things in his environment to help stimulate and get those things going, right? All right, check this one out with the adult. This one's real quick too.
Oh, wait, question. Was his
overwhelmed, like life is...
The way he was speaking, was that also like a part of ADHD where he had trouble like kind of forming sentences, or?
Yeah, so a lot of times because they have trouble focusing, right? And so even though they're answering a question, their mind is already off in another direction because they're searching their environment for stimulus. So he's answering, but you could almost see like he was thinking about other things, right?
Yeah, and I didn't know if that was just like him or ADHD.
And that's not typical. I mean, that doesn't happen to everybody with ADHD. Some people, it's not necessarily that they're thinking about other things, but they're talking to you and maybe their leg is bouncing at the same time. They're doing something in their environment to create stimulation to get mental arousal.
Is moving too fast and you simply can't keep up? Do you get distracted easily and have trouble focusing? First, yes. Well, so do I. For some, this is just everyday manageable stress, but for others, it can signal much more. Did you know as many as 10 million adults could have attention deficit hyperactivity disorder, otherwise known as ADHD? It's a mental health condition exhibited by difficulty maintaining attention, hyperactivity, and impulsive behavior. Its symptoms can be deceptive, and if you have the condition, it can take over your life.
I'm Jennifer. I have been diagnosed with ADHD in 2008.
My name's Steve Lindhorst. I'm 50 years old, and I was diagnosed with ADHD in 2009. In a normal day for me, I may find it easier to say how many times I'm not distracted. It's a constant battle.
I tend to become distracted in my thoughts during a conversation, and sometimes I can appear disinterested. It's not just with my children, it's romantic relationships. It was in my marriage. It's friendships.
I have my second marriage, and it's still very difficult because my wife has to cope with the results of ADHD.
ADHD has affected my relationship with my children in many ways, mainly because I'm always late. It looks as though I don't care about their event.
And I want to be dependable. I feel like over the years I've let people down whenever they relied on me for something and I forgot, and it seems careless, but it wasn't.
Getting a proper diagnosis and an evaluation is the best thing someone can do for themselves. Changed my life forever.
When I was diagnosed with ADHD, I felt like there was an answer to those questions. Why am I this way? Why am I this way, but everybody else seems to be that way? I think the hardest part about having ADHD is I feel I've missed out on certain things.
And Steve Lindhorst from Paso Robles, California, and Jennifer Gore from Chappaqua, New York are here. And also joining us is former Harvard Medical School professor and author of Delivered from Distraction, Dr. Edward Hollowell. Welcome to all of you. Thank you so much.
So that's a longer segment, so I'll save you, but that just gives you the big picture of, as an adult, not having been diagnosed on the earlier side, how it's affected their life. So can we see where it would be described as abnormal behavior or disorder?
Yeah, and they also portrayed it more as like more gloomy, as a more destructive like illness than just how the kid was portraying it, and he was very active with it and very like, oh, I'm using this to my benefit.
Right. And so there's that difference, right? There's that difference of where mental health was seen as something that you don't talk about. So you have these adults that have gone their whole life where they never sought out help from medical professionals because they just thought something was wrong with them and they couldn't get themselves together, as opposed to now we know. So parents are much more proactive about getting help for their children and saying, it's okay. It's okay if you have ADHD. There are ways that we can manage it. Where here these adults have suffered friendships, poor friendships or friends that have left because they felt like the person didn't care or wasn't paying attention. Like loving relationships they've had problems with their children, they've had problems, and they didn't quite know how to deal with it until they got a diagnosis, and then they can start thinking about what therapies would work best for them. So if you want to watch more of it, it's fascinating. The doctor's going to keep talking, but it is a little bit longer clip. But he does go through and explain a lot and talked about, adult ADHD and things like that, and just how once you know, then that's really kind of the gateway into understanding and then managing and living with ADHD. Does anybody have any other questions? Okay, you guys are wonderful. Thank you for showing up again. Does anyone have any non-psych related questions?
Mr. Yeah, my teacher never
likes
anything.
Okay. I'm making a note, and I'll go to somebody else and ask them if they can help.
Thank you so much.
You're welcome. I'll just go. I'll just contact the math department chair, and I won't mention your name, so don't worry.
Okay, thank you.
I'll just say there are questions in general. Does anyone else, Nicole or Kenzie, do you need anything else?
No, I'm good for right now.
Good. Well, it was nice to have you on with me again. We are getting towards the end, guys. I'm going to put out a schedule this weekend, but really next week is going to be our last sessions, and then I'm going to allow people time to catch up on things and or redo things and things like that, so that way people feel comfortable leaving the semester.
I like this class. I think this is like the one class I've like actually been like consistent with, and like, oh, like I want to go to psych.
Oh, yay. It's so, I just love the topic, right? Like it just pulls you in. Like if you're into it, it really like, and it really helps you to understand the people in your own life, and it helps you to understand who you are and how you relate to other people. So I think it's such an important one. If you ever, just because now it's such a shortened version of it, so if you ever get a chance to take like a psychology class in college, take it. You're going to learn so much more because there's so many things that we couldn't cover that we had to go like quick through. So definitely continue on if this is something that interests you. All right, guys. Well, have an excellent rest of your week and weekend, and then I will see you on Monday.
Hi, Mr. Rocco. Thank you.
Bye. Thank you.